Hello, everyone. This is Dr. Mike Cho, physical therapist. Hey, today we're going to be interviewing the CEO of Sara Health. We're going to be talking about what is remote therapeutic monitoring. We'll be back in a few seconds. Okay.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
Well, hello, my Facebook friends. Well, if you're watching live, comment live. Watching on a replay, comment replay. I haven't been going live recently, but we have a special guest for today. And of course, our special topic. Our topic is called remote therapeutic monitoring. I hope I'm pronouncing that right. It's hard to say monitoring, right? I could probably say remote. It's easy. Therapeutic. I've been saying that all the time. But monitoring, I can say monitor. English. English is the hardest language to learn. If you think English is the hardest language to learn, say English. And if you're an English speaker, say English too, right? All right, we got a special guest for today. He is actually the CEO of Sara Health. His name is Mr. Stephen Coen. I hope I'm pronouncing his last name right. And he's here to talk about what is remote therapeutic monitoring and what is Sara Health. And I have their subscription, obviously. Just a quick background. And we've been seeing patients already in the home, and also in our clinic. Shout out to Jerry Hab. I for some reason I just can't figure out. I have a subscription with MedBridge. I have the home exercise program with them. I've tried other companies and everything. And then here comes Anthony Maritano telling me, "Hey, Mike, you gotta reach out to this Steven guy." And like, who is he? And then I saw his picture, good looking. Of course, I reached out to him, good looking guy, right? But I saw him, and then he talked to me about it. He introduced his team, amazing team, and then now we're using it. I think we have around 50 people, 50 clients or something in our system. And I get to text and communicate with him through the system that he's developed. And of course, he's going to guide us what are the therapeutic monitoring codes. So without further ado, let's go ahead and bring in Stephen. Go in, Stephen.
And Mike, that by far the best intro I've ever gotten. So thank you for that. I appreciate it, and I look forward to hopefully being able to deliver some value in the form of just understanding why these codes got invented, what they actually mean, and then how groups can think about operationalizing them for their clinic like you all have. So yeah, I'm super excited, and thank you so much for having me today.
Well, first of all, thank you again for joining us. I know you're a very busy gentleman, but first of all, where are you from, man?
Kansas City. So from Kansas City, and maybe some background into how I got here. So I'm a frustrated patient. So I've torn my labrum, I've torn my ACL, my meniscus. I compete nationally as an Olympic weightlifter. So it's not if I have PT in a year, it's when and how much. So
That's true.
I came to solve a problem I faced personally on the patient side, which is I just felt like there was this black hole, this complete disconnect between visits, right? And I would go in for a visit, I'd make progress, I'd go out, I was great. Like, I'm highly, highly adherent and compliant. Like, I will do my home program, but the coming back and here, like, oh, how did things go in between the last time I saw you? It's like, man, like, I don't know. Like, I can tell you how I feel this morning, right? But being able to actually give you a log of my symptoms, my progression or regression over the course of the last few days, I can't do that, right? We patients are terrible historians, and that's why I started the company with a couple of the co-founders, who I think you've gotten to meet, at least our chief clinical officer, Paul, who has spent a little over a decade at the Mayo Clinic in Rochester, Minnesota. So we're bringing tech, business, and clinical together, and making practices some money, getting them paid for work they've been doing for decades at this point. And it's been a really fun ride.
Wow, wow. I remember you mentioned to me before, Stephen, that you didn't start it as your company didn't start as an RTM company, right? Is that
No,
correct?
no. We like to joke that we were doing RTM before it was cool. So the functionality has been really pretty close to the same for the last, gosh, call it 5-6 years. But as you probably know, and maybe for the listeners, the remote therapeutic monitoring codes came out in January of 2022, and we started the company in 2018, and we sold Sara to practices who contracted directly with typically pretty high risk employers, especially firefighters and police officers. And so they got paid lump sum, like $2 million from large city fire department to manage the entire population over the course of a year. And so these practices that were our customers were highly, highly incentivized to figure out how to get the highest level of compliance, even to the point of reducing unnecessary visits and getting better clinical outcomes with technology. Not replacing the in-person visit, right, but keeping patients progressing in between visits. And so that was the world that we grew up in. And then when these RTM codes came out, kind of all looked at each other and were just like, holy cow, this is what we've been doing for 3-4 years now. And now there's a space for us in the fee-for-service world. So a little bit of right place, right time, and just survival to be able to get to this moment. But yeah, to answer your question very shortly, no, we were before the RTM codes, but we were always doing this. It just wasn't in the fee-for-service world.
I love how you said that, man. I always say this: in the middle of crisis lies an opportunity.
Yep.
And remember that, ladies and gentlemen. If you're watching live, comment live, watching on a replay, comment replay. And that's what there was a crisis then. And then here comes Steven, the CEO, pivoting, changing. And that's what I want you to be, ladies and gentlemen. If you're watching, whether in my personal page or in our alternative career page or in our YouTube page or in the podcast, it doesn't hurt for you to pivot and change and adapt and adjust. So it's very important, as a small company. I don't know how. I mean, I'm a small clinic or small practice, and I don't know how big Sara Health is. I don't know, multi-billion-dollar company. But if you're starting a company and you want to do a good thing for your community or something, you got to learn how to pivot and change. And this is where he comes in, and he saw that opportunity, and then boom, grabbing that amazing opportunity. So now, Steven, now that you've adjusted to the pay for fee service or whatever you want to call that, um, how do you learn about RTM, and what is really RTM? For those people who are not, you don't know. I mean, a lot of us were practicing, but we don't even know. Even my own clinicians. So what is that? So tell us about that.
Yeah, how we hear about it, a mentor of mine, actually. So we didn't know the codes existed until March of 2022. To be honest, I didn't think something like this would happen in the lifetime of our business, and I have never been more happy to be just completely incorrect. Yeah, happy to be wrong on that one, and heard about it back in March. We put our first practice on in April and have grown. Let's see, we grew about 30x last year, about another like 10 times this year. So it's been pretty fun growth. But in terms of what are these codes, how we like to think about it is it's an incentive structure, right? So like a pot of money that is designed to incentivize investments in technology and time to deliver more care in between visits. That's it. And in terms of people not hearing about it, I mean, actually earlier today was talking with a practice owner, and we used to hear this a lot more than we do today, but still today, as we sit here on Thursday, December 12th of 2024, quote, I tried this during COVID. Like, no, you didn't. like you didn't try this during COVID. There's no way the codes didn't exist. And so while more and more people are hearing about it, I think the majority of folks are still in between what we call a knowledge level of -1 to 1 on a scale of 5, with 1 being I've heard of them, but I really have no idea. 0, never heard of them. And then -1 is, oh, it thinks they're telehealth, right? And these are very, very different than telehealth codes. Although I can understand how some of the similarity, you can make some similarity. They're very, very different, very, very separate. And we can get into the nitty gritty of it, but I think if folks just understand the foundation of this is a pot of money, so a monetary incentive to drive investment by practices in technology and time to deliver care in between visits, you're going to be well ahead of the average Joe and have a much better foundational understanding of what these codes are and are designed to facilitate.
That's good. That's good. So, I mean, I'm not pretending I know it all, but I'm gonna pretend I don't even know. I don't even know anything. So, correct me if I'm wrong. RTM codes, are they like codes like therapeutic exercise 97110, therapeutic activities 97 whatever 3535? Is that the code that we're talking about? I do know already because you educated me. But can you explain that to me? So, because like what is this? So it's is it a new code?
It is a new set of codes, right? So it is similar, or they are similar to like a TheraX or NeuroRead in that it is a CPT code, right? So if you're a PT, OT, or speech language pathologist, you're likely going to be billing 98975, which we call the Connect code. And that is just enrolling the patient onto the platform and monitoring them for 16 days. Then the Engage code, as we call it, so 98977, and that's if a patient engages with that platform 16 or more days in a 30-day period. Like basically, did they engage more than half the time? If so, yes. And I want to stop there because this is where these codes get really, really different than the codes that you're used to, and that there is no required time element to achieve those two codes. So no required time element. It's just simply, is the patient getting enough utility out of the software as a medical device that you're using to actually engage with it, right? And so, as you know, for us, is a patient getting enough utility from the daily questions that they are answering via text message that they're willing to use their time, their resources to respond, right? Which is still an ask. The patient has to self-report some level of data 16 days in a 30-day period or more in a 30-day period, but it doesn't require your time. There's no 8-minute rule. None of those things apply to the Connect or Engage code. Now, there are two other codes we call them the support codes of 9980 and 9981. And that is for the time that you spend delivering care in between visits, right? It's calling the patient, it's the phone call into the clinic. That time that right now you're just donating to United, to Medicare, to whoever, that you can start actually getting paid for that. And it makes a lot of sense, right? Because they're calling you. They're not calling their sister. They're not calling their brother, their dad, their grandma, right? Maybe they are going to ChatGPT first, but ultimately they're calling you, and you're delivering care to that patient in a way that's likely increasing the chance of their plan of care completion, increasing the chance of a better clinical outcome. And especially when you think about, well, why would insurance pay for this? You're reducing the chance of recidivism, right? If you can get more patients through the plan of care, which we see, and we can talk about the research we've done there, get more patients through their plan of care, the likelihood that they're going to have a recidivism episode goes down dramatically. So it's one of those things like, hey, if I'm already spending $10 and I can spend $12 in order to have a better chance at not having to pay $10 again, like you're going to do it, right? Every day of the week. And so that's where we see these RTM codes. But I hope that helps separate that. Yes, they are CPT codes. That part is similar, and you put it into your note just like any other CPT code, and you bill it. But especially that Connect and Engage code there's no time requirement. by you as the clinician. And for the 98980, 98981, the support codes, there is time required, but it's again different than your typical like in-person or treatment codes.
Well, thanks for explaining. And then, but before we keep on going, ladies and gentlemen, have you seen those Zoom videos wherein those people who were like pretending they were frozen, and then they were frozen, but the fan was still turning? So I know if you're frozen or not, man. So because you got your fan turning there. Anyway, for those watching again, the RTM codes, they're just like those therapeutic exercise, therapeutic activities that we're billing. And then, of course, there are different parameters or rules wherein you're going to that you mentioned about connect code, engage code. Just today, I've been texting, doing the self-awareness medical device for our patient. And then she called. Patient called and then had concerns, and I logged. It was just a call. It wasn't a telehealth visit. She called the office. She wanted to talk to me, and I logged that minute. I'm running out of English, man. I logged that minutes in the software, and it automatically captured and calculated it for us. And then at the end of probably that certification period, not certification period, but the end of the billing cycle
Yep.
of that Sara system, it will collect all, and then once you collected all those minutes, then you can start billing. Of
Yep.
course, you cannot just wait the whole day and then okay, I'm gonna bill a whole whatever, you can't do that, so it has to be a distributed amount of time where you're really monitoring the patient using a software. We used to use MedBridge for them to be able to interact with us and their home exercise program. Now we use Sara Health. Well, shout out to MedBridge. I love MedBridge. If you need the CEU classes, still use our code called the alternative. But of course, Sara is really, this is really what they do. RTM. MedBridge, what they do is CEU classes online. So yes, the MedBridge does the RTM, but they don't monitor the stuff for you. Sara monitors the stuff for you. In that way, it will tell you, okay, it's ready to bill. It explains to you, okay, this is the amount of time you're ready to bill, and this is the code that you're gonna bill. I don't know about MedBridge, but that's my main. Maybe they could improve it in the future, but that was my main thing. I didn't know how to bill it. I didn't know how to use it. It's just there for the communication with the patient and for them to do the exercises, and that's it. With Sara, just so you know, if you're a practice owner or you're a mobile patient or mobile clinic or outpatient clinic, it will help you obviously to put the patient name and everything. They will monitor everything for you. So all right, anything else that I missed, Stephen?
No, I don't think so. As we think about the RTM, right, we think about it in three phases. There's enrollment, care delivery, and billing, right? And so our thought process and how we focus as a team is how can we be just absolutely ruthless in rooting out administrative burden in enrollment and billing, because that's where this thing's going to fall apart, right? Is I have trouble getting patients into the system, not going to work. I have trouble billing, not going to work. And so, to your point, RTM is all we do. That is it. That is all. It is our entire focus as a company, as a technology. And so, this is what we think about every day, all day. Is how can we simplify enrollment? How can we simplify billing? How can we make it easier? And by no means are we done. But that's, to your point on focus is incredibly valuable, right? And so we see that a lot, and we're going to continue to give updates. I think probably just in the few weeks that we've been together, you've already seen some updates come across, and in the next few weeks you'll see more. So we're extremely hungry to make it easier.
Yeah. Well, why are you looking at me when you say hungry? I am always hungry, man. Anyway, so I like what even the software itself, well, of Sara, because it will send an email to you when the patient replied to you. I don't think MedBridge has it. You will have to go to the platform for you to be able to look at the patient's response. in whatever they did. Unlike with Sarah, it goes directly to your email, and of course you have to click, and then it will go to the Sarah website. And then, like what Steven said, uh, us we're already confused with our EMR. We're confused with the home exercise program already. We're confused with the billing website already. It's so much buttons to click and everything. But when you look at the Sarah Health website and how they use it, very simple. You just put the patient's name. You don't even have to put the date of birth, their number, and then your plan. Is it a home exercise plan? Is it a manual therapy focus plan? A false management plan? A deconditioning plan? One thing I need to add, Stephen, could you add some OT plan of care and of course lower body plan of care stuff like that, so we could differentiate if it's an upper body plan, lower body plan, low back plan, or something like that.
We
So,
have some stuff
but
that I'll make sure gets added to your account after this. So I've got a
yeah,
note.
so
I've
because
got a
the
note
patient,
to
I have like patients who would text me, who would say or send a message like, well, why are you sending me lower body stuff for therapeutic exercise, and I came there for a neck issue, which is I still exercise focus, you know what I mean?
Yep.
So anyway, any last parting wisdom for our team or people who are watching who would like to learn more about RTM? Do you have like a learning website or a YouTube page where they can watch and see you in action, or like a blog post or something?
We do have a decent amount of information at sarahealth.com. So the sarahealth.com. If you'd like to take a deeper dive and see how Sara could work for your practice, just reach out to Tom on our team, which is just Tom, TOM, at sarahealth.com. He runs our growth, and so he's the person to talk to on that front. Or you can book a demo with him directly at sarahealth.com to be able to do that. But yeah, we have information there and a variety of YouTube videos and other pieces, like with now with you, right, with Tony who introduced us, and a variety of others, where we just are really trying to make people realize that this is not this gargantuan thing that they have to bite off and chew. It really should fit into their current workflow as much as possible. And in really good scenarios, and we see this a decent amount and hopefully more in the future, is this should just feel like a natural extension to what you're doing already, or a replacement to communication that you're already doing, right? And so a lot of times like to use the analogy of the Battle of Thermopylae, or as was cinematized by Zack Snyder, right, the 300 movie. The reason why the Greek army was so successful is because they pulled all the Persian army into the hot gates, right? And so a singular point of entry, it made the Persian army numbers for naught. And yet it's how I see a lot of clinicians acting today, is battling in the open, in that you have multiple different planes of communication that you're trying to juggle, and ultimately it's driving a lot of missing the ball. It's driving a lot of headache and moral injury, because you're like, okay, well, I gotta monitor my personal email, my work email, my cell phone number. Heaven forbid I have a work phone number. Patients calling into the clinic, I got to call the patient from the clinic, Facebook comments, right, patient portal, all that stuff. And it's just like, how am I going to manage this barrage of information? And so our goal with Sara is, okay, for all the clinical information that you need to make clinical decisions, both in and outside of visits, funnel all of that into Sara, so that way you can be like the Greeks in the centuries past, where you're not fighting the battle in a environment that you can't win. Instead, you're setting up the environment in a way that you can not only win but excel in the communication battle, and really go above and beyond for your patients without adding to your plate.
That is so true. That's so true. Thank you very much, Stephen, for explaining the 300, because that's actually my body right now. 300 pounds. Just kidding. Not 300, 300 the men, right? 300 pounds. Well, again, thank you very much, Stephen. Appreciate you for your time and your effort, and also for answering the call to be amazing, because many are called, but few are chosen. And you are the few chosen one who will answer this call to be amazing in leading the way for RTM. You'll never know. Again, any last parting wisdom? Where can they find you? Where can they reach you? Website and everything?
I think just sarahealth.com. Head there, learn a little bit more, book a demo, or reach out directly, TOM, so Tom at sarahealth.com. And we'd love to see how we can serve you on your RTM journey.
Cool. Well, thank you very much, Stephen. Appreciate you, and shout out to Tom too. But before I let you go, ladies and gentlemen, always remember the word fast, FAST. Letter F. People that will bring out the best in you, because you are the average of the 5 people you hang out with. So whoever you hang out with, that's going to be you. Today, I hang out with Steven. I feel like I want to be the 300. What is it that they shout? Hoo-ha! Something like that. Or the
Hoorah,
City Chief.
hoorah.
All right. So you want to be like them, right? You're going to be like Steven. Next letter is letter A. Take action. All this stuff that we're doing is not going to it's not even going to do Stephen good if you don't take action. Take action by reaching out to him. Go to his website, sarahealth.com. And perfect action beats perfect in action. All the stuff I do, even in this clinic, we've grown our clinic to 7 locations, and it's still not perfect. Nobody's perfect. I mean, I'm sure probably Stephen is perfect, but nobody's perfect. Probably Sara Health. You know what? We forgot. Let's bring him back in. Why Sara?
All right. So speaking of imperfect, we started the company. We called it the Surgery and Recovery Assistant, but people kept asking us if they had to get surgery to use it. And so bad name, back to the drawing board. So luckily we chose letters that have a lot of potential options. So today we are the Strength and Resilience Assistant. So we're bringing stronger and more resilient patients and practices. So that's Sara.
Wow. Okay. See, I thought it was like an ex-girlfriend or something, man. So.
No.
All right. Okay. Let me go back. All right. Okay. Let me go back to my spiel. Okay. Next letter is take action. All the stuff that we're doing is not going to do me good. It's not going to do Stephen good if you don't take action. Take action. Go to their website. Check them out. sarahealth.com. And next letter is letter S. It's letter S. It's Sara Health. No, share, subscribe. The more shares, the better, because it may not be applicable to you. It could be applicable to someone else. So you may not use it for now, but if you have a friend who in private practice and you feel like, you want to start RTM, tell them about this, okay? And last but not the least is letter T, is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And that's what Stephen and Tom and his team is doing. They're teaching us how to understand the remote therapeutic monitoring codes. Again, thank you very much. Be awesome, be great, be excellent. And we'll see you in the next episode of our Alternative Healthcare Career Show. Bye-bye.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for. HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.